Patient Dr. Jim Anderson had long known the importance of a beautiful smile. Once he began offering Lumineers to his patients, he realized the solution to improving his own smile. It was observed that the centrals were quite prominent among the varying sizes and lengths of his upper anterior teeth. He desired a uniform and balanced smile. His intraoral evaluation concluded adequate candidacy for the procedure, with normal temporomandibular condition, no traumatic incisal relationships, and a good standing of periodontal health. Determined by the width of his smile, Dr. Anderson's treatment plan included 11 Lumineers. He chose Ultra Bond shade Supreme White for uniform whitening, and no cosmetic contouring was necessary.
So Lisa has taken these 10 veneers right here called Lumineers, and she's treated them first with an organic acid, citric acid, and you need that to activate your silane. And when you do that, you're going to get a really strong bond. She's also polished the patient's teeth with the porcelain polishing paste and getting everything ready. And the reason we do the porcelain polishing paste is got an enzyme in there to remove the plaque. First step we're going to do here is we're going to roughen the porcelain with a micro etcher. Don't breathe and close your eyes. And he's got beautiful margins on there. Upper left, second bicuspid, and first molar. Now normally what I do is where you see the metal margin, I'll take a small round burr and I'll remove the metal and try to get it just behind the porcelain. And the purpose of that is that I don't want to show the metal. But in his case, those margins are so perfect, those teeth are so far back, but I want to keep those margins intact, so I'm going to sacrifice a little aesthetics when I put the porcelain over it, rather than take the metal away. And now I'm putting paint on dental dam on, so that the Ultra Bond and the bonding material won't stick to the lingual side of the teeth. It makes cleanup a lot easier. Only thing you have to guard against is if you have diastemas, you don't want it running from the lingual side of the teeth to the interproximal embrasures and prevent seeding of your luminaire. And close your eyes. Coating that lingual side with that paint on dental dam really saves you a lot of time in finishing. Now we're going to take Porcelain. Porcelain is a buffered hydrofluoric acid. We've buffered Porcelain to come to a pH of 2.6, so it's much safer to use. We have a little brush here. It's got medium viscosity, and we etch the porcelain. Okay, and now we're putting on porcelain conditioner. We put porcelain conditioner also on the veneer. What is porcelain conditioner? It's an organic acid, and the organic acid is citric acid, because phosphoric acid won't activate your silane. Now we're putting phosphoric acid on the enamel. Now we'll push this around with the brush. Now the reason I like etch and seals, it has aluminum oxalate in it. So if you're using it in your regular operative procedures, and you have exposed dentin, the aluminum oxalate will seal the tubules. Okay. I'm taking Serenade Prime and putting it on the porcelain. Okay. And then we're going to take Tenure AB. And nothing bonds better or more reliably than Tenure AB. Now since he's picked out the shade, I'm going to show you something here. Lisa has something called Tenure S. And Tenure S is a bond enhancer. So I'm going to put Tenure S over all of these prepared surfaces. And the reason is I want to protect them from contamination. Now what I'll do is put these on. I can't stress enough how important it is to have a good working team. Okay. All right, let's just continue on the right side then. When we spot cure this, we're going to stay one tooth distal to the last tooth so that we don't cure any of that resin and prevent seeding of the next tooth. So now we're going to take and remove most of the excess. Gently push these down, never squash them, just gently. And I want to make sure that I see a little excess everywhere. Close your eyes. Close your eyes. And close your eyes. And we're going to wipe all of this from the occlusal and gingival toward the incisal. Close your eyes. And we'll let everybody take a look at the lingual side. See a little ultrabond in there? Now I take a Sure 349 and we just start lifting it off, going all the way around. This is coming off really nice today. Now I'll let you take a look at the gingival margins. Aren't they nice and clean and sharp? Look how easy that was. Huh? So now we're going to take the football-shaped diamond, and I'm going to go around on the occlusal surfaces and the lingual surfaces and blend the ultrabond, the porcelain, and the tooth structure together. All of these instruments are in the clinician's finishing kit. All right, now we've blended everything on the lingual side. So we'll take the 12-fluted burr, and all I'm doing is going around the gingival margins and the interproximal using a 12-fluted burr to remove the ultrabond. Something else that's going to make this work rather simply is I'm wearing magnification. Now we're going to take the Sure 349 instrument. That's an orthodontic instrument, but we're not going to use a hygienist scaling instrument because that would scratch the porcelain. Because of the moisture and because it wasn't etched, I'm able to start sliding off the set ultrabond on that smooth labial surface. So now we're going to take the long, narrow diamond, and I'm going to follow the outline of the porcelain because we don't have hardly any ultrabond left there. And I will carve away everything I don't like looking at, and I will blend the margin with the tooth structure. And these things start to come to life now once you get the definition of the embrasure. Next most important thing we want to do is check the occlusion. Open. Now close. So I've got a mark on enamel, a little bit of a mark on that lateral, and on the molar. I'm going to have to take a little off there. So I'm going to take off the occlusal porcelain on the upper left first molar. And we're going to take a little off the distal lingual of the maxillary left lateral. Now we're going to open the contacts. And for that I'm going to use a little device called a seri saw. And what you can do when you start going through these contacts, if it doesn't saw through easily, stop sawing and start rocking. And what you don't get done today, when the patient comes back tomorrow, a lot of the contacts open on their own. Okay, now we'll take a seri sander. Seri sander is what orthodontists use to open and reduce tooth size. And I just go back in to smooth where the ultrabond would be kind of rough so that the floss will go through. So we just go on the lingual side of this and polish it up. And usually that roughness disappears anyway after you've brushed a little bit. So now we'll let the patient take a look at it. So far he hasn't had a chance to see it.
Having them put on was really quite easy, just easy. My staff took the impressions for me when I sent the case in, and you know, that took 15 minutes or less. I had a pretty nice smile, my teeth were straight, so it never went through my mind. After I found out we could do all this cosmetic work, I just said, you know, how can you lose? It's great.